Welcome to a new episode of Norway Perspectives, brought to you by Norway Relocation Group, helping newcomers navigate life in Norway with clarity, structure, and personal support. In this episode, we take a deep dive into a topic every new resident in Norway will encounter sooner or later: how to understand and use the Norwegian healthcare system. Whether you're moving to Norway for work, study, or family life, you'll need to know how to register for a GP, what's included in the public system, when to pay and when it's free, where to go in an emergency, how to access specialists, and how to navigate the system as a non-native Norwegian speaker. We'll also show how learning basic healthcare-related Norwegian with NLS Norwegian Language School can make your medical visits less stressful and more effective, even if you're just starting out. Let's begin. 1. Is healthcare in Norway public or private? The answer is mainly public, with some limited private options. Norway has a universal healthcare system, funded by taxes and coordinated by the Norwegian Health Economics Administration, HELFO. If you're a legal resident, you're automatically part of this system. This means you don't need private insurance to access care. You are assigned a GP, Helsenorge. You can access hospitals and specialists through referrals. You pay small fees for doctor visits, prescriptions, and outpatient services. Children under 16 get free healthcare. But it's not completely free. You do pay a small amount per visit, usually around 200–350 NOK, unless you reach the free court threshold. We'll explain that shortly. 2. Your Helsenorge, the GP system. Every legal resident in Norway is entitled to have a Helsenorge, or assigned general practitioner. Your Helsenorge is your main contact for regular checkups, illness and injuries, referrals to specialists, prescriptions, medical leave and sick notes, how to get a Helsenorge, go to Helsenorge, no login with your bank ID. Search for available GPs in your area. Choose one and request to switch if needed. You can change your Helsenorge twice per year for free. If your assigned doctor has a long waiting list or doesn't speak English well, it's worth finding a better match. Appointments are usually booked online or by phone, and waiting times range from same day to a few weeks depending on the issue. 3. What does it cost? Here's how payments work. GP visit, 200–350 NOK emergency room, legevakt. 350–500 NOK blood tests or minor procedures. Extra fee specialist visit with referral, 350–450 NOK. Mental health, referral required, then same cost as above. Children under 16, free pregnancy care and childbirth. Free hospital stays for treatment or surgery. Free. Once you've paid around 3,000 NOK in a calendar year, you get a Frikort or exemption card. For the rest of the year, you don't pay anything for public services that fall under that scheme. Prescriptions are partly subsidized. The price depends on the medication and whether it's chronic or short-term. 4. Emergencies and legevakt. If you have a serious but non-life-threatening health issue outside of office hours, go to the nearest legevakt or emergency clinic. For example, high fever, minor injuries, illness after hours. Sudden health changes. Legevakt is available in every municipality. In cities, it's a large public walk-in center. In smaller areas, it may be connected to your local doctor service. For life-threatening emergencies, always call 113, the national emergency medical number. Ambulance care is included in the public system and fully covered in emergencies. 5. Specialist care and referrals. You cannot book a specialist directly unless you're using private services. Instead, go to your Helsenorge. If needed, they'll write a referral, henvisning. You'll receive a digital or letter confirmation of your appointment. Specialist wait times vary by region and urgency. Non-urgent dermatology, 2 to 4 months orthopedics or surgery consult, 1 to 6 months. Urgent mental health, 1 to 4 weeks, with fast-track systems. Once you're in the system, you'll be notified by SMS or letter, but the communication is usually in Norwegian. This is why learning practical healthcare vocabulary through NLS Norwegian Language School is one of the smartest things newcomers can do. 6. Maternity, pediatrics, and child health. Pregnancy, birth, and child health care are well supported. Pregnant women are assigned both a midwife and a doctor. All prenatal care and delivery costs are covered. After birth, your baby is automatically registered with a pediatric team. Health clinics, Helsenorge, provide checkups, vaccinations, and growth monitoring. Children receive care up to age 18 with no out-of-pocket fees. School health services, dental care up to 18, and speech therapy are also included in the public system. 7. Mental health care. Norway takes mental health seriously, and support is available through GPs, first point of contact, psychologists, private or public with referral, psychiatric services in hospitals, community-based support programs. Public therapy requires a referral and may involve waiting lists. Private therapy is available but can be expensive, usually 1,000–1,500 NOK per session. If you or someone you know is in mental health crisis, call 113 for emergencies or your local legevakt. Some municipalities also offer crisis teams or low-threshold counseling. Ask your GP. 8. Common challenges newcomers face. New residents often experience confusion with digital tools like Helsenorge language barriers during appointments, missed letters from Skatteetaten, or Helfo difficulty, finding a fast ledge with short wait times, fear of misunderstanding health documents. That's why it's so important to learn basic medical Norwegian, know how to log into Helsenorge, use Altinn to receive government messages, ask for a printout after your appointment if you didn't fully understand. At NLS Norwegian Language School, courses include real-life phrases for doctors, pharmacies, and emergencies, common health-related words and expressions, role-play exercises, patient-provider conversations, vocabulary for prescription labels, test results, and insurance. 9. What's private, and is it worth it? Some people choose to supplement the public system with private care, which includes private GP clinics with short wait times, direct access to specialists, private imaging, MRI, CT scans, mental health therapy with faster access, health insurance through your employer. Private services can be helpful for time-sensitive issues, second opinions, non-emergency needs when public wait times are long. Prices range from 1,000–3,000 NOK per appointment, depending on provider and service. 10. Final thoughts. Norway's healthcare system is one of the most accessible and equitable in the world. But like everything in Norway, it's structured, and you need to understand how to use the system properly. Know how to find and change your fast ledge. Be aware of what's free and what's not. Understand when to use legevakt, a GP, or emergency services. Ask questions and learn some Norwegian. It makes the entire experience smoother and less stressful. At Norway Relocation Group, we help clients register with the system, choose the right services, and avoid common mistakes. And when it comes to the language of healthcare, we always recommend NLS Norwegian Language School, where you can learn the words, phrases, and confidence you need to manage your health and your families in Norwegian. Thanks for watching this episode of Norway Perspectives. If you found it helpful, please like, subscribe, and share it with someone new to Norway. And we'll see you in the next episode.